Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Anne-Marie Costello with the Office of Health Insurance Programs for New York State.
Hi, thank you for having us here today.
Welcome to the show.
Thank you.
Can you please tell us about what you do for New York State Department of Health?
Sure. I'm a bureau director within the Office of Health Insurance Programs at the New York State Department of Health, and I work on Medicaid issues for New York City. But more interestingly, we have a statewide campaign called the Connections to Coverage campaign, which is New York's outreach effort to promote health insurance for children, teens, and adults.
Now, you must have a lot of people to help in New York State, huh? What are the numbers of uninsured in New York State?
The most recent data shows us that there are 2.5 million uninsured children and adults under the age of 65.
Wow.
About 400,000 of them are children, and slightly more than 2 million are adults. Here in Albany County, there are about 22,700 uninsured adults.
Wow. So what are the two New York State programs that can help New York State residents of low income with health insurance?
Sure. New York provides health insurance coverage to adults through our Medicaid and Family Health Plus program. The Medicaid program is a health insurance program for low-income adults. It provides an extremely comprehensive health care package. And our Family Health Plus program builds on top of our Medicaid program and is a low-cost health insurance program for adults 19 to 64 years of age who are not eligible for Medicaid.
Okay, so Medicaid covers all ages and covers with the people with lower income, right?
Exactly.
Okay, so now we understand what Medicaid is.
Right.
Why don't we talk about Family Health Plus?
Sure.
Who is eligible for Family Health Plus? Can you repeat the ages again?
Sure. Basically, our Family Health Plus program is a health insurance program for adults 19 to 64 years of age who are not eligible for Medicaid.
Okay. And what are the benefits that they can receive from Family Health Plus?
Sure. Both Medicaid and Family Health Plus have extremely generous benefits packages and are really designed to meet all of the health care needs of adults. Through Family Health Plus, adults can get regular checkups, physicals, visits to the doctor when they're sick, hospital care, emergency care, specialty services, dental, vision, some mental health care services, prescription medications. And adults that participate in the Medicaid program are entitled to even more services.
Okay, so that's pretty comprehensive. So basically, the health care is provided at just about any kind of location, right?
Well, both here in Albany County, for both Medicaid and Family Health Plus, actually, for Family Health Plus, all adults have to pick a health plan to participate in. So they have to pick a health insurance company. Most adults in the Medicaid program in Albany County also must join a managed care plan. And then they can use the network of providers that are part of that health plan. So they could see the doctors, the pharmacies, the hospitals, the clinics that participate in the health plan that they choose.
Okay, so they can't just go to anybody. They have to make sure that they're an approved provider with the plan that they're a part of.
Sure, just like most employer-sponsored coverages, managed care programs, so you see the network of providers in that plan.
Okay, so let's say you want to join Family Health Plus. How much does it cost to join, and what are the premiums?
Okay, we're very fortunate in New York. There are no monthly contributions or premiums for either Medicaid or Family Health Plus, but in both programs there are small co-payments for some services.
Okay, so let's say somebody out there that's watching thinks that they want to apply. what do they have to go through to do that?
Sure. To apply, there are two ways that families or individuals can apply for health insurance coverage. They can work with the facilitated enroller, and facilitated enrollers are community-based organizations and health plans under contract to the New York State Department of Health, and the facilitated enrollers can help an individual complete the health insurance application form and gather all of the documents that they need to support that application. So as part of the application, adults will need to provide proof of identity, their age, their address, and their family income, neither their citizenship or immigration status. And sometimes gathering those documents are complicated for individuals, and a facilitated enroller can help them through that process.
Well, it's good that we don't have to worry about doing it all on our own, right?
Exactly.
So what are the provider choices that the facilitated enrollers come from in Albany County?
Sure. In Albany County, there are 4 facilitated enrollment organizations. The first is the Healthy Capital District Initiative, and then there are 3 health plans that also offer facilitated enrollment services: Fidelis Care New York, GHI, and WellCare. I just want to say that also to apply, if a family or an individual wants to, they can apply for Medicaid and Family Health Plus at the county Medicaid office. So they can go to the local Department of Social Services as well to apply and receive application assistance there.
Okay, so just so I'm clear on how to apply, they can either go to Social Services,
right,
or
they can apply through a facilitated enroller out in the community. Facilitated enrollers offer application assistance throughout the entire community. They're located in schools, in child care centers, in community centers. They have offices. They offer evening and weekend hours, and they also offer assistance in multiple languages.
All right, and so what they do is they'll tell you about all of the plan choices in the area, even if they work for the plan.
Absolutely. They provide plan choice, exactly.
Okay, and the documentation part of it isn't too complicated, right?
It's not too complicated, but some families, you know, for instance, you have to prove your address. Sometimes a family doesn't have a lease for their apartment, or maybe they're 2 families living together in the same apartment and the lease is in the other family's name. A facilitated enroller can help a family figure out the right way to document everything that's appropriate for the application.
Okay. So how do we know if our income levels are appropriate to apply for Family Health Plus?
Sure. You know, figuring out income can sometimes be complicated for families as well. So really, if it's a parent that's applying for health insurance coverage and they have a monthly income of about $2,700 a month for a family of 4, they may be eligible for coverage through either Medicaid or Family Health Plus. If they're a single adult or married without children, they would be eligible, a single adult, up to about $900 a month, and a married couple without children are eligible up to about $1,200 per month in family income.
Okay. So they can certainly call if they have questions about the income levels.
Absolutely. Income can be very confusing. And so if they make around that much money, even if they think they're not eligible, they should call our hotline number and they can walk them through the eligibility and really do a screening and figure out whether the individual or the adult is eligible for Medicaid or Family Health Plus.
Okay, so this isn't just an issue of somebody being unemployed, right?
No.
They can have jobs, they can have income.
Absolutely. They could absolutely have income. These are programs designed for working New Yorkers. As a matter of fact, about 75% of New York's uninsured are either workers or the dependent of workers, and many of them don't apply for coverage because they just assume because they work they're not eligible. Medicaid is really, and Family Health Plus are both designed for working New Yorkers, and the vast majority of individuals that receive their health care through Medicaid and Family Health Plus are workers.
Well, the thing that would make me sad would be somebody wouldn't take a job because it would put them over the income level for health insurance coverage, but you hope that's not going to happen.
Or if they get a good job, that health insurance is provided by the employer.
Well, and I understand that the cost of HMOs and health insurance coverage is how much has it gone up?
Oh, it's gone up. Yes, it's gone up dramatically.
I mean, for years. For my job, we never paid anything. Now we have to contribute towards the cost of the HMO because it's just too much money.
Exactly.
Anyway, what about Medicaid income requirements? That's less, right? That's figured differently?
It's figured out differently. So the numbers that I said before, you know, $2,700 a month for a family of four. If a family makes up to that amount, the adults would be eligible for either one of those two programs. So if they come in, and they don't need to figure out whether they're Medicaid eligible or Family Health Plus eligible, a facilitated enroller can screen them for their eligibility, because we count income differently between the two programs.
Okay, so basically you don't have to know much about your income or anything else. You contact a facilitated enroller, and they can tell you where to go.
Absolutely, they'll walk them through the whole process, exactly.
Okay, and then just to be clear, Medicaid covers any age.
That's right.
And Family Health Plus is only certain ages.
Right, exactly.
Okay.
Medicaid covers children, adults, senior citizens. Our Family Health Plus program is a Medicaid expansion program for adults 19 to 64 years of age.
Okay. Now, let's say you have a job and you have health insurance through the job, but you can't afford the premium every month. Maybe it's too much money.
Right.
Can New York State help with that at all?
Sure. We do have a program called our Family Health Plus Premium Assistance Program.
Okay.
So if it's a low-income worker who would otherwise be eligible for Family Health Plus, except for the fact that they have insurance through their employer, they can go to a local Medicaid office and screen to see if they're eligible for our premium assistance program. And if it's cost effective and the health insurance that's offered through the company is comprehensive enough, the county can look at and maybe help that worker pay for their health insurance.
Do you have any numbers on the number of people that you're covering right now?
Oh, yes.
Is it raising? Is it going higher
Absolutely.
with the unemployment rates going
Well, I mean,
up?
it's actually gone higher even before the unemployment started to increase. We had just slightly more than 4 million people enrolled in Medicaid and Family Health Plus in New York State in January of 2008. And in December of 2008, we had about 4.2 million. So we saw an increase of about 140,000 in 2008. And that we also recognize at the Department of Health that we have a goal to enroll all children and eligible uninsured adults into health insurance coverage. So we've done a number of things to make it easier for families and individuals to apply for and keep their health insurance coverage. So we think a great part of the increase in enrollment are some of those things that we've done to make the program easier. The expansions, the simplifications, and then towards the middle and the end of last year, you really do start to see maybe the impact of the downturn in the economy. But our enrollment started increasing early in the year.
Now, are there other agencies in Albany County that help the uninsured?
Sure. There are federally qualified community health centers that can see the uninsured. There are private providers. Many of the hospitals have charity care, sliding fee scale programs that can help the uninsured. Because while we talked about that there are 2 million uninsured adults in the state and about 22 or 23,000 here in Albany County, only about 40% of them are eligible for either Medicaid or Family Health Plus. So there's a large number of adults who won't qualify for public coverage, and there are the alternatives of the community health centers and the hospitals.
Right. Okay. Now, the last thing I'm wondering is there a grassroots outreach campaign for the Department of Health to get the word out to everybody in New York State about your program?
Absolutely. When we really took a look at who the uninsured were in New York, we realized that there were a number of barriers to reaching those individuals. Some they don't understand that these programs exist. They're unaware about Medicaid or Family Health Plus. As I said before, about 3/4 of the uninsured are workers, and they assume that they're not eligible for coverage. And there are some individuals that don't understand the importance of having health insurance and the need for primary and preventive care. So to try to tackle that issue, we at the State Department of Health launched the Connections to Coverage campaign, which is our statewide outreach campaign where we have staff that goes around the state. We have staff in New York City, the Capital District, Western New York, that we go out to where the community is. We present and we do presentations, trainings, outreach activities at churches, at schools, at daycare centers, at soup kitchens, at food pantries, any place where families and individuals are that we think that are likely to be uninsured. We've set up partnerships with WIC providers. We've set up partnerships with healthcare providers. You know, who knows better about who the uninsured are than healthcare providers? So we've set up referral systems to really work with community groups to help identify families that need health insurance and then connect them to the facilitated enrollers.
Okay, so the people with the Division of Coverage and Enrollment will actually send literature out to whoever wants it and do presentations,
those
right?
literature, presentations, participate in health fairs, yes. Come to PTA meetings, yes.
Okay. Well, great.
Good. And we're very happy to do that.
Was there anything else you wanted to add before we were done?
I just think, you know, we talked before about these tough economic times, and really we are confronting a time where unemployment is rising. And when unemployment rises, people lose their jobs, they also lose their health insurance coverage.
And they will not go to the hospital when they're sick?
They delay getting care, absolutely. You know, uninsured do not seek care.
Yeah.
They wait longer to get care. When they do get care, they're diagnosed at more advanced stages of diseases. So to try to avoid large gaps in coverage, the Department of Health is joining efforts with the Department of Labor to go out and work with companies who are about to do layoffs or about to do company closings, plant closings, to really educate workers about the availability of New York's public health insurance programs, or maybe even COBRA, which may be an option for people who are about to become unemployed.
I mean, I've heard about COBRA, but it seems like the monthly premium is very high.
Right. COBRA can be very expensive. I think the average premium is about $1,000 a month. But under the Obama administration's stimulus package, there's a subsidy. So if someone involuntarily loses their job between September of last year and July of this year, they may be eligible for a 65% subsidy for their COBRA. So they would only be responsible for 35% of the premium.
That's very good.
So they should talk to their HR departments at their company to see if they're eligible for the premium subsidy program.
So hopefully New York State's governor and President Obama have this as, you know, they want to help people that are uninsured.
Absolutely. Governor Patterson has laid out a goal to enroll all children and eligible uninsured adults into Child Health Plus, Medicaid, and Family Health Plus. And that's why the last 3 state budgets, we've done a lot to simplify and expand coverage options for children and adults, and also launched our Connections to Coverage campaign.
Great. Okay, we're just going to do a review.
Okay.
Medicaid.
Okay.
Just do a little quick review of Medicaid.
Sure. Medicaid is a free health insurance program for very low-income adults. There are no premiums for Medicaid, but some adults may have to pay some co-payments for some services.
Okay, and that's any age, right?
That's any age, right.
Okay. Now, Family Health Plus.
Family Health Plus builds on top of our Medicaid program and is our Medicaid expansion for adults. It is for slightly higher income adults who are between the ages of 19 and 64 years of age who aren't eligible for Medicaid. There are no monthly premiums, but there are some co-payments for some services.
Okay, and then once you hit 65, then Medicare takes over, right?
Medicare takes over if a senior citizen is eligible, yes.
Okay.
And if they have Medicaid, they may be able to keep their Medicaid as well.
Right.
But Family Health Plus ends at 64.
But when you hit 65 and you're low income, you can have Medicaid and Medicare.
Yes.
How do you keep track of all
Well,
these
that's why
things?
we have our facilitated enrollment program and our county Medicaid offices that can really help walk a family through the process.
Okay, so let's mention your toll-free number. You want me to do it?
Yes, please.
1-877-934-7587. I think it's 1-877-FHPLUS. I don't think that's enough numbers. All right, and the website, nyhealth.gov.
Yes.
www.nyhealth.gov.
Yes.
And they can click on
Medicaid and they can click on Family Health Plus.
Okay. Thanks for coming in.
Thank you very much.
Thanks for watching. We hope to see you next time on Focus on Health.